Hey, welcome. I want to start with a question for you. What if a medication for one big problem, say diabetes, could actually help with a totally different one, like achy joints? It sounds a little unlikely, doesn't it? Well, today we're going to dig into some fascinating research that suggests there's a very real link. Let's get into it. So let's just put it right out there. If you're one of the many people managing type 2 diabetes, there's a good chance you might also be dealing with the chronic nagging pain of osteoarthritis. It's a tough combination, for sure. But what if one of your diabetes meds was secretly pulling double duty and actually helping to protect your joints? Okay, so let's start with this surprising connection. We know juggling both of these conditions is a daily grind, but there's a real glimmer of hope coming out of the scientific community, and it's all focused on one specific type of drug. The drugs we're talking about are called SGLT2 inhibitors. I know, it's a mouthful. But what they do is actually pretty simple. For people with type 2 diabetes, these meds help the kidneys flush excess sugar out of the body through urine. A standard tool in the toolbox, right? But here's the twist. Researchers are now thinking these exact same drugs might have this incredible, totally unexpected side benefit for our joints. So that brings us to the next logical question. How in the world did anybody even figure this out? Well, the answer comes from a massive new study that sifted through a mountain of data to find this potential link. And when I say massive, I mean it. Scientists looked at the health records of over 100,000 people with diabetes. 100,000. When you're working with a data set that big, the patterns you find, well, they start to carry some serious weight. And the way they designed the study was really clever. They took two big groups. Group 1 was on those SGLT2 inhibitors we've been talking about. Group 2 was on a different but also very popular class of diabetes drugs called GLP-1 agonists. By comparing two effective treatments, they could try to isolate whether one of them had a unique, extra protective effect on the joints. So it all boiled down to one really simple but powerful question. Was there any difference between these two groups when it came to their joint health? Specifically, did one drug give people a better shot at avoiding osteoarthritis? And the results? They were pretty striking. The patients who were taking the SGLT2 inhibitors had a 26% lower risk of developing osteoarthritis compared to the group on the other drug. 26%. That is not a small number. That is what we call a statistically significant effect. Okay, but how, right? How is it possible that a drug designed for blood sugar could also be protecting your cartilage? This is where it gets really fascinating. Let's jump into the science. Scientists think there are three main things going on, and it's probably a combination of all of them. First, there's weight loss. Second, a reduction in inflammation all over the body. And third, there might even be a direct protective effect on the cartilage cells themselves. Let's start with the easiest one to understand, weight loss. These medications often help people lose a bit of weight, and for your joints, that's a game changer. You know, for every single pound you lose, you take about 4 pounds of pressure off your knees. It's just simple physics. Less pressure means less grinding and less wear and tear over the years. The second idea is all about inflammation. You see, we used to think osteoarthritis was just mechanical, like parts wearing out. But now we know it's also an inflammatory disease. Inflammation is a key villain that damages cartilage. And here's the connection. SGLT2 inhibitors are actually known to have anti-inflammatory effects throughout the body. So the theory is, if you can cool down that body-wide inflammation, you might be protecting the joints from the fire. Makes sense, right? Now, these findings are genuinely exciting. But before we get carried away, we have to pause for a quick reality check. What does this research actually mean? This next part is probably the most important thing to remember. It is absolutely crucial to understand that this was an observational study. All that means is that it found a link, an association between two things. It saw that people taking the drug also had better joint outcomes. But, and this is the big but, it cannot prove that the drug caused the better outcome. This difference is everything. So to put it simply, yes, the study found a strong link, but no, it does not prove the drug is the direct reason for the lower risk. We're going to need more research, specifically things like randomized controlled trials to confirm that. For now, this is a very exciting clue. So what's the bottom line for you right now? It is not that you should ask for this drug just to prevent arthritis. Absolutely not. The way to think about this is as a potential bonus benefit for people who already need this medication to manage their type 2 diabetes. And that leads us perfectly to the most important part of this whole conversation, taking this information and using it to have a better discussion with your own doctor. Let me be crystal clear. The goal here is not to hear this and decide to change your medication yourself. Never, ever do that. The goal is to use this knowledge to become a more informed partner in your own healthcare. So, how do you start that conversation? It can be really simple. You could say something just like this. Hey, doc, I read about some new research linking SGLT2 inhibitors to a lower osteoarthritis risk. Considering my diabetes and my joint pain, could we talk about whether this kind of drug might be a good option for me? That simple question turns you from a passive patient into an active partner. So I'll leave you with this final thought. What if one prescription could help solve two problems? The future of medicine is all about finding these kinds of integrated solutions. Thanks for watching, and just remember, empowering yourself with knowledge is always the first step to a healthier you.